بسم الله الرحمن الرحيم. الأستاذ المساعد دكتور وسام وهاب صاحب الحمادي، أستاذ مادة تقويم الأسنان في كلية طب الأسنان جامعة بابل. Our lectures today is about removable appliances. Removable appliance is one of the most important appliances which are used during orthodontic treatment. From the past many years, the use of a different configuration and different type of this appliance during the treatment, applying for correction of different type of malocclusion. Now, today's we have another type like fixed myofunctional combination, and the other is after modern orthodontic field. Therefore, we need today to scope about removable appliances. Removable appliances can be removed by the patient from the mouth. Movable appliance consists of a different component. This component lead to the move the teeth, while other component for stability of appliance in the oral cavity, like base plate, and sometimes here the wire, heavily arch wire, also used for stabilization, and sometimes we need to apply a slight pressure on the teeth if recommended or needed. Therefore, removable appliances are those appliances that can be inserted and removed from the patient's mouth by the patient for cleaning or by dentists for adjustment, activation. These type of appliances, as well as suited to treatment of a simple type of the malocclusion, not complicated like by fixed appliance, type of removable appliance, passive or active appliance. Passive appliances which doesn't exert active pressure in the teeth, instead they try to remain the teeth in their position. Retainer, habit breaker, good examples for these appliances. Assist the normal growth of the dentition and bone formation, especially in the early orthodontic treatment. Also space maintainer. Another example for passive removable appliance, and they are designed to maintain the teeth in their present position. Pedodontists must have knowledge about that space maintainer. Very important to have a knowledge and the skill about this field, because the treatment plans sometimes need to this type of passive appliance. Here in this picture we can see two different styles. Space maintainer, in order to prevent mesial drift or movement of the molar here in the area, in order to give a sufficient space for uninterrupted teeth here. And while in the another type, a habit breaker used for stopping the habit, here the cribs or any type of configuration can be embedded in the acrylic translucence or white acrylic here, and therefore this can prevent thumb sucking by child, or prevent tongue from the palatal side of the teeth. And according to the type of malocclusion and recommendation, we can use and construct this type of passive removable appliance. Active appliances, while these appliances which perform teeth movement by a force generated from the appliance itself, like spring, screw, and other type. Therefore, this type of the screw or spring have a different cross section, have a different length, therefore exert different types of the force on the teeth. The force on the teeth must be within normal physiological distance of the tooth or teeth. If over exert heavy load may lead to the root resorption or not lead to the tooth movement. And also if we have force less than optimum force needed for the tooth movement, may be lead to the not move the teeth in the good direction planned by orthodontists. Component of a removable appliance: active component, retentive component, base plate, and anchorage part or component. Active component: springs, screw, elastic, or combination of others. Springs. The spring is attached to the acrylic base plate from one end that is called retentive tag, while the other end is free to move and exert force, which is called normal physiological force, called the active arm, that is mainly ended by non-traumatic end. The main alloy used for construction spring is a hard stainless steel alloy with the difference ratio of chromium and nickel, which are suitable for tooth movement. Spring action is a very important present in the wire during the types of the spring. Here we discuss some types of the spring, like Z spring or recurve Z spring here. This for movement of the teeth in the labial direction, and recurve Z spring lead to the move of the teeth, and also in the labial direction, but a group of the teeth, and here for single teeth. Used for movement tooth or group of a teeth from the palatal to the labial position, also can be used in the first couple system. First couple system, thus mean another Howley arch present here. Z spring or recurve Z spring push the teeth labially, while Howley arch here labially push the teeth in different or opposite direction, not at the same line, and may lead to correction the minor rotation less than 90 degrees, because if the rotation of any tooth 90 degree, we need or recommended fixed orthodontic appliance. Here the finger spring, another type of spring which are used with the removable appliance, simple or guided, different configuration according to the recommendation. Used for mesiodistal movement of the anterior teeth and the premolar area. Sometimes this type of spring if the teeth located within the line of the arch. If the tooth outside or ectopic eruption, we not advised to use this type of spring. Therefore, we can use different cross section of stainless steel wire. The diameter of a spring from 2 to 3 millimeter, also present here in order to maintain tooth within the line of the arch. Sometimes the crack near the coil, but for canine near to the crown of the canine. Buccal canine retractor, third type of the spring, may be used here for retraction of the canine. If the canine outside the line of the arch, we can call it ectopic eruption. From its name used for distal movement, usually inclined canine, not distally, contraindicated use with the distally, and when the tooth is buccally and medially inclined. The modified buccal canine retractor is used for distal and palatolingual. We have two fours distally, and we can push the canine palatally to keep it within the line of the arch. Therefore, if the canine or tooth outside line of the arch, we recommended or need buccal canine retractor over finger spring for retraction of the canine if the canine within the line of the arch. Howley arch here, Howley arch use either passive or active. Passive as a retentive part, anterior retention for the appliance. For movement of the anterior active, if the Howley arch active, that's mean movement of the anterior teeth palatally or lingually. When there is increased overjet, but with a limit. Also in the minor rotation, less than 90 degrees, with the Z spring or screw in force couple system. If the Z spring here and Howley here, and we have a slide rotation less than 90 degrees, we can exert force labially and force palatally by Z spring or screw or other type of spring, and unsolve the problem of rotation. Robert retractor, other type of spring which are used in this removable appliance. Used when overjet increase above 6 millimeter, while in the Howley arch if the overjet less than 6 millimeter, but with the Robert more than 6 millimeter to retract anterior teeth, compress of two buccal canine retractor. The Robert doctor constructed this spring by composed of like buccal canine retractor with labial bar connected. Buccal canine interjoined at the labial and within a labial arch as shown here in this picture. In this picture, in these photos, we can see in crossbite of the lateral, a slide rotation also here in the lateral. If we use couple foot Robert from the labial and lingually screw or Z spring, we can correct the crossbite here and slide rotation here, for example. The second type of the active component of the removable appliance, screws, different styles of the screws used for movement, single or group of the teeth as in expansion, also used for expansion, anterior or bilateral posterior. It can be activated by turning it weakly. The force of activation will be stored inside the periodontal membrane of the teeth. Third part of active component of the removable appliance, elastics. Elastics store the force of activation from the long period of the time. It can be produced as steady amount of the force to move the teeth, and it is more acceptable aesthetically than springs. Now we talk about retentive component built in a clasp. Built in the clasp here, we can see for retention of the appliance in the undercut, which is present between the molar and the premolar here. Adami clasp. Adami clasp is a more famous clasp which are used in all types of the removable appliances, and this retentive pad is a very important. Sometimes in the posterior teeth and sometimes we can use it in the anterior teeth, but we must take in consideration the adjustment of a row here. The U shape must be not more than forced in the undercut area in order to avoid extrusion of the tooth or teeth if we are use sometime double Adam on the 5 and on the 6, or on the 6 and 7 according to the need of the dentist. C-clasp. C-clasp, which are constructed very easily during prosthodontic department during construction of the removable partial denture surgery, and this also used as a retentive. Sometimes we need it because partially erupted. We cannot use Adam or another cause. Sometimes we need to use C-class. Fitted labial arch. Here we can see the fitted labial arch, which are used for retention or for anchorage the appliance in the anterior segment. There the fitted labial sometimes used to the group of the teeth, or maybe to the upper central, for example, in order to prevent dislodgement of the appliance from the anterior position. Base blade, this is the major connector for all parts of removable appliance. It must be exerted in the whole palatal tissue and must be attached to the imposure. These extensions are useful for distribution of the food that exert by active component to move the teeth to its shares in the anchor. Here we can see the difference different color, different type of the base plate which are used for these purposes. Bite plate, it is a self-fabricated to the base plate to clear the occlusion or to reduce the overbite if it is interfere with the tooth movement. Types of the bite planes: anterior bite planes, and then posterior bite plane. Anterior here and posterior here are shown in two figure on the study cast. Anterior bite plane. It can be used when the occlusion interferes with the tooth movement, or when we have deep bite. They are usually flat and parallel to the occlusal plane. Enough height to disocclude posterior teeth, 2 to 3 millimeters. Enough width to occlude with the lower incisor with the mandibular is retruded. It should not incur tongue space in order to not prevent tooth from the normal movement and pronunciation of some letters. Posterior bite plane. The indication: reduce or overjet, reduce an average overbite, reverse overjet, unilateral posterior coarse bite. Therefore, it should be thin, because if the thick lead to the interfere with the occlusion of the patient, become more uncomfortable for the patient, and be a child don't wear the appliance. You've used it, and sometimes remove it without parents know about that. It has been wide enough to cover buccal and lingual surfaces. Occlusion should be equal in the both sides. Anchorage. Now we put few lines about anchorage. The anchorage is a very important subject. We must have many lectures about anchorage in order to cover this title. Anchorage is provided by site, which is the force of reaction generated by active component of the appliance. Reciprocal anchorage, the movement of two equal sized teeth, one against to the another. Example in the central diastema, during correction of central diastema by finger spring. Simple anchorage, movement of a small tooth against larger. One example, movement of the lateral incisor against smaller when we need to visualization or distalization, etc. Stationary anchorage. Three types of the anchorage. The first one reciprocal, the second one simple anchorage, and third one stationary anchorage, used in combination of fixed and removable, obtained by palatal bar joint molar bands and during using fixed orthodontic appliance. Number 4, intermaxillary anchorage, movement of the tooth or teeth in one arch against tooth or teeth in the other arch. Example, upper and lower arch. Indication for removable appliance, we put simple points about that. It's only capable to producing tilting movement of individual teeth. Indicated where simple movement are required to correct mild malocclusion. It's becoming more widely used to transmit force to blocks of the teeth and as an adjunct to the fixed apply treatment sometimes. It provides means of applying extraoral traction to segment of the teeth or an entire arch to help achieve extrusion and distal movement. It's also used for arch expansion. It's used passively as a space maintainer following tooth extraction before the time of fixation, during the trauma, during heavy dental care, and also following fixed appliance treatment. Advantage. It's majority of malocclusion that requires simple tipping. Here we put line under simple tipping of the teeth. Can be satisfactorily treated by removable appliance. Many tooth movement, especially tipping and overbite reduction, can be undertaken as readily as within fixed appliance. Removable appliance also can be incorporated by plane forms to eliminate occlusal interference, which not possible with the fixed appliance. Here is a very important point. Number 4, tooth movement, which is a simple and only few teeth moved at any time. So this means that the control is less complex than within fixed appliance. Number 5, simple malocclusion may be treated by general practitioner with the adequate training. 6, less chair time needed as appliance manufacturer in the laboratory. We need laboratory effort for that. Therefore, the chair time during a treatment session is a very short if compared with a fixed and another type of orthodontic appliance. They are relatively inexpensive to contract. 8, They can be removed by patient for cleaning. Both appliance, teeth, thus difficulty of hygiene are not increased because the control of that is during removable of the appliance. Number 9, in any problem with the appliances can be removed for a short period of time until operator can see the patient. Therefore, take the patient enough time to take decision. Limitation. We have a very important limitation. Multiple rotation can be readily be treated, while rotation of one or two appearances can be dealt with. Multiple tooth movement have been carried out a few at a time, and this will prolong treatment in more complex cases. Therefore, the multiple tooth rotation, multiple tooth movement, and at the same time limited in some removable. Controlled forward movement of the buccal segment to close residual space is difficult or impossible, so extraction of the tooth with the excess space may be sometimes limited uses. Extraction of other teeth than first premolar of their poor condition, missing or ectopic position. It is difficult to obtain space closure and good proximal contact between the teeth adjacent to the extraction space. 5. Lower removable appliances are not well tolerated due to the encouragement on tongue space and rotation problem. Very uncomfortable to the patient, really, because the movement of tongue restricted. The pronunciations are very, very difficult to the patient. Therefore, patients sometimes ask you, please, doctor, can you minimize the thickness of the acrylic base? Can remove it sometime. Number 6, the uncooperative patient may be sometimes leave out this appliance, and this will prolong the treatment, and uncontrolled drifts of the teeth may be occur, and this is a bigger problem for parents and for the doctor, for orthodontists also. Contraindication. The contraindication of this appliance can be summarized by 4 points. Severe class 2 or class C malocclusion. Really, severe class 2, class C need many complex for a system, not only tipping, simple tipping movement, where extensive lower arch treatment is required, where the teeth must be moved bodily, or where the teeth are multiple rotation, where sometimes pattern unfavorable, as in severe competently and severe skeletal pattern. And thank you very much for audience and for my students and for all help me in this lecture. We can see you next time. Thanks.